Good afternoon. Welcome. Today's Friday, September 11th, 2020. Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's our Titus Regional COVID-19 update. Sorry we missed last week being the holiday weekend, but we're here this week and we're excited. Some news that is happening about the health system and is happening about our community. I want to start today just remembering today as September 11th. I remember when it happened 19 years ago, or 9/11/2001. We were living in Austin. I was working for a company that was doing business in airports, and I remember early that morning when I went in about 4:35 and started working, talking to our airports on the East Coast when it happened. I remember when Angela called me about the news of 9/11 and we hit the towers and what it meant. And we were talking all day long. I was the inside to all of the airports that were part of our company because they'd shut off all the news media in the airports, not knowing what was going on. So it was a traumatic day in a lot of lives. And we remember today the people that were lost, the fire department, the policemen, the first responders who were lost that day as well. So please today, in your own way, say prayers for the family, say prayers for the friends and the people impacted as part of that in our history as it changed our lives. As we talk about COVID, and as it also is going to be one of those things that we look back in 19, 20 years about changing our lives as well and the new norms. As part of that, I am excited for Titus Regional Medical Center. When COVID started back in March, we had to close our pain management clinic. It was a hard decision, but given what was going on with COVID and was going on with all the shutdowns, we had to shut it down in March. We're excited this week as we opened it on Tuesday. Valerie Snyder has been just a pleasure to be a part of this clinic for several years for here at Titus, and she was very understanding in March when we had to make that decision. She gratefully came back a couple days ago and joined us in August, and we opened this last Tuesday, September 8th, the clinics. It's on the second floor now in 204A. Right above where we sell popcorn in the lobby. But we're excited that the Center for Pain Management at Titus is opening. It's strong. The patients, the people who sent me texts and letters over the last 4 to 5 months who were not very happy with me, I truly appreciate your patience in allowing us to open back up. And we've opened it stronger. Valerie is a great addition to our health system, but Scott Campbell will join us on Tuesday. And Scott is an anesthesiologist, pain management doctor who joined the Pain Management Center on Tuesday. So not only do you have Valerie, but a physician full-time will be working in the clinic. We're excited. Dr. Campbell and his wife have been here for several weeks as part of our community, joined us from West Texas via Central Texas as well. So we are excited what Dr. Campbell is going to bring as far as pain management. He offers the full aspect of services related to pain management and doing procedures. So we are excited about this addition to Titus, and we continue over the last few weeks another great announcement for the healthcare community in Mount Pleasant, Titus County, and Northeast Texas. As far as COVID testing and continuing the testing going on, I just want to keep reminding people that there is testing offered at gogettested.com is the state testing that's happening at the Civic Center. 150 plus a day, Monday through Saturday, are being tested over there. So please check out this website for the times that they're open, how to get maybe pre-registered to get your results. Heard quite a few of my friends and family members who've gone and got tested. It's worked well. So that is still being offered. No symptoms are required. Anybody can be tested. Please encourage you to keep using that to the end of September. And again, a special thanks to Chief McCray and Judge Lee for their work, the mayor and the city manager also for their work of getting us this resource from Mount Pleasant. It's the center of Northeast Texas. Those 150 tests a day are coming from all over surrounding counties and communities. So it's a great job by them. We truly appreciate this resource. Please take advantage. As we deal with COVID, I coughed at the same time. I tickled my throat. But we start dealing with flu season. September and October means flu season in Texas. And this is going to be a weird year as we go into the fall and into the winter of what flu season is going to look like in a COVID world. We're encouraging to get your flu shots. We're pushing our team members and our staff as part of Titus and our patients that are part of Titus to get their flu shots. We've ordered tests, try to get the shots in early to start giving them, but flu shots have started. I got my flu shot last week, but we were excited to offer these in our clinics and to our team members. So please encourage you, your parents, your children to get your flu shot. It's going to be a very critical time this year to see how it works with COVID. So those flu shots are available. We encourage you. We're pushing this hard this year. If you check us out on Facebook, Tracy and her team are doing quite a few things around flu shots, trying to encourage you to get out there. We'll be having some health fairs in October. They'll be a little different this year, and I'm excited about what they're doing with the health fairs. But flu shots will hopefully be offered at those that health fair as well. So look for your opportunities, and please go to your primary care doctor to get your flu shot. It was a little bit late today. We usually do 1 o'clock, but we had to move it because of a meeting at 1 that we had. A new project that we're going through is in 2018, many of you remembered we upgraded to Epic. Epic is the electronic medical record, and in your world, it's probably MyChart. We are the only independent rural health system in the state of Texas that uses Epic and MyChart. It's a great tool. It's been a wonderful resource for our health system and our physicians and our physician practices and our community members. We are going to upgrade in November. It's only been 2 years, but through a partnership and an alignment with Ochsner out of New Orleans, we are going to upgrade our Epic and our MyChart. So you're going to see some changes over the next few months and some things. You'll start getting emails and some things through Facebook and other about changing your MyChart access and doing those things. But we're excited about what it's going to offer. The new tool, Triton, is our project. It was Thor 2 years ago, if you remember. It was some late nights and some stressful times. We're looking for a more seamless integration this time. We're excited. We've been on Epic for 2 years. Epic is the world leader in the EMR across the world. And through COVID, they've done some great things. And our relationship with Epic and our relationship that we'll be building with Ochsner in New Orleans is going to offer this community from a healthcare some great things. You'll see it in MyChart. We just got out of a meeting of looking at what MyChart now will look like. And you'll have the ability to have MyChart while you're in the hospital, in the patient room, to see what tests and to see your doctor and those types of things. So it was a great ad that we'll have. Those types of upgrades we'll see with education and things on videos on your phone. We're excited about that. It's a big deal, but if you see coming out of COVID and just still the things about COVID, Triton is going to be another thing that we tackle, and we're excited about that. As we talk about tackling and COVID, let's talk about the numbers. Over the last few weeks, we've seen a decrease. And in August, we were running between 80 and 100 positives a week. We're now down into 10s and 20s. Last week, we had less than 20 positives that came through the hospital. This week, we're running about the same that's come through the hospital in the ER and through inpatients. So we're still seeing them. We have two patients in the hospital this morning. We've been running about 3 all week, several in ICU and 1 on the floor, and now no in ICU today and just 2 on the floor. We're still seeing a couple a week. I would still encourage all of our community members to still stay diligent. The ones that this is impacting, it's deadly. And we're still having patients where you see they're having a tough time. For the most part, we're seeing not as severe and acute as it was over a month and a half ago. So some good signs. We're excited to see those. We're following the rest of the state of Texas and the South as Texas declines. And over the last 2 weeks, we increased our cases 7%. Northeast Texas increased their cases 13%, and Texas increased their cases 10%. So we are below the state and region average. We're still seeing COVID. We're still seeing it, and people are coming in to get procedures and surgeries, healthy-looking individuals, and then when they test for their surgery, they have COVID, and they're COVID positive. So I would encourage you to please stay diligent. Please wear your mask. Please social distance. Please sanitize. But football season is here. Rodeo was last week. We are moving forward. We're going to have to learn with school starting and going into the winter and the football season, how do you live in a new COVID world? So please, social distance, sanitize, wash your hands, and please wear your mask. We appreciate your support. We appreciate everything that you do for our community. We look forward to, as we get into the fall, the breeze in the air this morning was a pleasant surprise, and we're excited to feel that, maybe pull out our flannel jackets over the next couple weeks and start getting ready for Christmas time in those. But thank you again for your support of Titus Regional Medical and our health system. God bless you. God bless all healthcare workers. Thank you to our doctors, and thank you to our staff, and thank you to their families for allowing them to do what they do for Titus Regional Medical Center. Have a great day.